Official case counts refer to the number of people who have been tested for COVID-19 and whose test has been confirmed positive according to official protocols. Many countries, early on, had official policies to not test those with only mild symptoms. An analysis of the early phase of the outbreak up to 23 January estimated 86% of COVID-19 infections had not been detected, and that these undocumented infections were the source for 79% of documented cases. Several other studies, using a variety of methods, have estimated that numbers of infections in many countries are likely to be considerably greater than the reported cases. On April 9, 2020, preliminary results found that 15% of people tested in Gangelt, the center of a major infection cluster in Germany, tested positive for antibodies. Screening for COVID-19 in pregnant women in New York City, and blood donors in the Netherlands, has also found rates of positive antibody tests that may indicate more infections than reported. Seroprevalence-based estimates are conservative as some studies show that persons with mild symptoms do not have detectable antibodies. Some results, such as the Gangelt study, have received substantial press coverage without first passing through peer review. An analysis in early 2020 of cases by age in China indicated that a relatively low proportion of cases occurred in individuals under 20. It was not clear whether this was because young people were less likely to be infected, or less likely to develop serious symptoms and seek medical attention and be tested. A retrospective cohort study in China found that children and adults were just as likely to be infected. Initial estimates of the basic reproduction number, R0, for COVID-19 in January were between 1.4 and 2.5, but a subsequent analysis concluded that it may be about 5.7, with a 95% confidence interval of 3.8 to 8.9. R0 can vary across populations and is not to be confused with the effective reproduction number, commonly just called R, which takes into account effects such as social distancing and herd immunity. By mid-May 2020, the effective R was close to or below 1.0 in many countries, meaning the spread of the disease in these areas at that time was stable or decreasing.